How's everyone doing?
Good morning. A little cold.
Nice to meet you too. Are we ready upstairs?
Anytime.
Hello everyone. I'm Nick Stavropoulos, the Acting Auditor General of Ontario. I'm pleased to be here today to present our 2023 annual report and highlight some of our key observations. Today, we have tabled 12 value for money audits in the Legislative Assembly. These cover a broad range of topics, from health, public safety and education, to travel and tourism, and the environment. We have also included a report on the public accounts of Ontario, a report on how well ministries are meeting their obligation under the Environmental Bill of Rights, a review of government advertising, and our follow-up reports, which track whether previous recommendations have been implemented. Our annual report identifies areas of improvement for the entities we audited. We have also seen when we audited these entities that the public service is doing good work in areas to deliver programs and services. Nevertheless, in reviewing the results of this year's value for money audits, there's a number of important areas worth highlighting, and I'll mention a few here today. This year, we've conducted 4 healthcare audits. Our audit of emergency departments found there were over 200 unplanned temporary emergency department closures over a 12-month period leading up to June 2023, involving 23 hospitals in the rural and remote areas. Closures of this type were very rare prior to the pandemic and are largely due to nursing shortages. Hospitals are trying to address these shortages through the hiring of temporary agency nurses, which is a more costly solution. Emergency department wait times were relatively stable over the last 10 years leading up to the pandemic, but they've seen an increase since then, up to 30 minutes compared to 10 years ago. We found similar issues with our audit of hospitals in Northern Ontario, which have become more reliant on agency nurses than other parts of Ontario. Patients in the north have a harder time in accessing timely and equitable care than those in the more populated south. However, we noted that there is no dedicated healthcare strategy to address the issues facing those living in Northern Ontario. The more reliance on agency nurses was something that we also noted in our audit of long-term care residential services. The staff-to-resident ratio varied significantly among the long-term care homes we visited, especially during the evening and overnight shifts. This can compromise the quality of care residents receive. In addition, our audit found that long-term care homes often failed to meet provincial standards in terms of the number of hours of care provided to residents. A common theme in these 3 audits was that the shortages of nurses and other staff challenges is an issue. A province-wide strategy to help hospitals and long-term care homes maintain appropriate staffing levels is critical for the sector's success moving forward. In our audit of Public Health Ontario, an agency created to give scientific health advice, we found it was not consulted about key public health decisions, including the decision to increase Ontario's access to alcohol and gambling. In addition, we found that Public Health Ontario was not taking the lead in performing or coordinating testing for the surveillance of some diseases. Our audit of driver training and examination program found that reduced driving test requirements, limited oversight of driving schools and instructors, and the lack of retraining suspended drivers creates the potential safety risks. In ensuring that drivers have effective training, and are proficient in all aspects of driving are critical in keeping Ontario's roads safe. Our audit of Ontario's two science centres found that both have been struggling financially due to declining attendance and memberships. In the case of the Ontario Science Centre in Toronto, we have found that the government decision to relocate the centre to Ontario Place was not fully informed. The financial analysis did not include all costs, key stakeholders were not consulted, and some relevant information that was available was not included in the final proposal to decision makers. In our audit of the two government-owned convention centres, we found that both Metro Toronto Convention Centre and the Ottawa Convention Centre have focused on their own profitability rather than events that would have maximized the economic benefit of the province. By focusing on their own profitability, the centres missed the opportunity to host additional events that would have added millions of dollars to Ontario's economy, a key part of the centre's mandate. Our audit of the province's tourism supports program found that the ministry has not developed a clear plan to help tourism and the tourism sector recover from the COVID-19 pandemic. We have found that if advertising dollars spent to market travel to Ontarians were reallocated to advertise to the United States, the province could have potentially seen an increase in U.S. visitors and tourism that would have added more to Ontario's economy. Our audit of the Travel Industry Council of Ontario, which regulates the travel agents in the province, found that the council's structure and responsibility have remained largely unchanged since its creation in 1997. The internet has changed the way Ontarians travel and do their travel plans, yet consumers are only protected by the council when they purchase travel from those with a physical location in Ontario. Our audit of Ontario's aggregate resources found that infrequent inspections of pits and quarries in the province and lax enforcement have contributed to companies not adhering to extraction limits and other requirements. In our annual review of the operation of the Environmental Bill of Rights, we found that the government made significant changes to energy, land use planning, and housing policies without either giving members of the public clear or complete information about the proposed changes or did not consult with key stakeholders potentially affected by the decisions. In our audit of York University, we found that, like many other post-secondary institutions in Ontario, York depends heavily on international students for its tuition revenue. This exposes the university to financial risks if enrollment declines due to factors such as shifts in Canada's relations with other countries. We also found York committed $745 million on new construction projects over the last 5 years, which have limited its ability to address the more than $1 billion in outstanding maintenance and repairs for its existing campuses. In closing, it takes a great deal of hard work and effort to produce an annual report of this size and scope. And so I want to extend my personal thanks to my senior management group and the rest of my professional and dedicated team in the office for the great work they've done this year. I would also like to thank Bonnie Lissick, who finished her 10-year term as Ontario's 13th Auditor General in September. In addition, I want to thank Susan Klein, who retired after serving the office for almost 35 years and retired as the Assistant Auditor General. I also want to thank Krishna Murphy, who spent many years in the OPS, but spent his best 8 years just now working with our office. Thank you for your service. Finally, on behalf of my office, I want to express my appreciation to the deputy ministers and their teams, along with the leaders of the agencies and broader public sector organizations we audited, whose hard work and cooperation assisted us in completing this year's annual report. Lastly, I want to thank the members of the Standing Committee on Public Accounts and All-Party Committee of the Legislature for their support and for their dedicated work on examining the ways government spend taxpayers' money and the way programs are delivered for the benefit of all Ontarians. We look forward to continuing to serve the Legislative Assembly, and through it, Ontarians. I appreciate everyone's time here today, and I'll be happy to take any questions.
Auditor, do you have a suggestion on what would be a reasonable cap for fees charged by temporary nursing agencies? You said there's no legislation, so I'm wondering if you have any thoughts on it.
Well, when we did look at emergency hospitals and the healthcare sector, we have noticed that there's a big dependence on agency nurses. Now, that's because there's a number of nurses that have left the field. The use of agency nurses is a temporary fix, and we're suggesting that the Ministry of Long-Term Care and the Ministry of Health develop a strategy to figure out how we can attract nurses back into the field. Now, with respect to that question, that's something that we did not look at. We did identify that agency nurses are costing at times 2 to 3 times higher than what they would be paid. A nurse would be paid currently working in the government.
Is there a link then to be drawn between what a nurse is paid by the Ontario government and what they're paid by the agencies? Are they being underpaid essentially by the provincial government?
I think that's a strategy that the government needs to look into as part of their strategy. That's an issue that they need to look at as part of the strategy. And there's a number of other factors, and it's not just the dollars. It's the environment that they're working in. It's their shift work. There's a number of factors that they need to take a look at when it comes to that. And I think that a strategy is necessary in order to have success in both the hospitals, healthcare sector, and long-term care.
Did you actually get to take, or your office get to take a look at the contract that the government had signed with Therma?
Therma is related to the Ontario Place audit, and that's an audit that's currently underway right now, and something that our office doesn't speak to while we're conducting the audit.
But you did mention about the parking garage, and parts of the contract seem to have some kind of a financial obligation that the province has with this parking garage. Could you kind of spell out what exactly you found in there, and if that was surprising or kind of inconsistent with other contracts a government of this size might sign?
So what we noted with regards to the Science Center, because the audit was on the Science Center, what was presented to decision makers was that an integrated parking lot with the Ontario Science Center will help with regards to that type of parking solution.
Okay, but the dedicated spaces on public land paid for by taxpayers owed to a private company, is that from the auditor's view value for money for Ontario taxpayers, especially if taxpayers are on the hook if the province doesn't meet those obligations?
When we looked at it, we did note that there is a commitment to provide parking. That being said, when we looked at the Science Center, what was associated with the Science Center decision was that the relocation of the Science Center can contribute to an integrated solution for the parking lot. Now, subsequent to the finalization of this report, there's been some discussions with regards to the parking lot itself, and that's something that we'll be looking into in our audit of Ontario Place.
Overall, you said that the government didn't take into account all costs of the relocation of the Science Center when it was comparing cost-benefit of relocating versus renovating. What's your assessment of whether it's actually a good deal for taxpayers to move versus refurbishing?
So we could not conclude on the reasonableness of the cost-benefit analysis, since there was a lot of relevant costs that were not included in that cost-benefit analysis. As part of that, there was transaction and financing costs associated with the P3 model to either deliver a relocated center and as well with regards to refurbishing the current center. The incremental costs that could have been attributed to the parking lot was not included. Now, that was part of the information that was provided to decision makers, but not part of the cost-benefit analysis. With respect to the proposal provided to decision makers, there was a number of other issues that we found that we wanted to highlight. There was information that was available with respect to the attendance and the attendance study done in 2002. What was provided in the proposal to decision makers was only information about the increased attendance to tourism. But that study also identified, and what was excluded in the decision to proposal makers, was concerns raised about school groups and suburban families' attendance declining. In addition, what was excluded was information around access and traveling time to the new site. What we also found was a lack of consultation. The school boards, which account for 25% of attendance at the Science Center, were not contacted or discussed. There was zero discussion with the school boards with respect to their impact on it. So there's a number of factors, both qualitative and quantitative, that did not go into the decision-making package for decision makers.
Why do you think that was? Do you have any insight about why these decisions were made the way they were?
I can't speak to intent. What I can speak to is the fact that there was a lot of information that was not put forward to decision makers.
Would it be a reasonable interpretation of what you have in your report that the government intentionally chose to cherry pick information to support this idea of moving the Science Center? Would that be a reasonable read of this report?
I can't speak to intent. What I can identify is our audit noted a number of areas where the cost-benefit analysis lacked information, where key players, even the landowners of the Science Center, were not contacted and consulted. School groups were not contacted. Information regarding a legislative mandate with regards to building and selling exhibits were not part of the decision-making package. So there's key information that we found that was not included in the decision in the package to decision makers to make that final decision.
What was the rationale for the focus on travel and tourism in the report this year? There are several different items that you focused on.
Well, we're coming out of the pandemic, so we wanted to take a look at the travel and tourism industry. And through that, we noted that in our audit of convention centers, for example, there's a lot of opportunity that we missed in bringing in bringing tourism into Toronto. So there's a number of events that they could have hosted that we found that they did not obtain. And those lost events could have contributed millions to the economy of Ontario. So their focus on profitability rather than bringing in economic impact was something that we think should be changed.
Are there any overarching themes you can draw from the convention centers, the TICO, and the Ontario Destination Ontario reports?
Well, with respect to TICO, TICO was developed back in 1997, and there hasn't been a change since then with respect to how they operate. And at the end of the day, how people book travel right now has changed significantly. So we recommended that the ministry look into how TICO will operate going forward and how they will benefit those that are trying to be protected. Because at the end of the day, it's a protection agency at the end of the day. With respect to tourism, the key there is lost opportunity. And that lost opportunity is a huge economic benefit to the province.
Back to Ontario, please, just for a second. You mentioned the costs associated with the P3 financing and other costs were not included in the estimate for the new building. Do you have an estimate on what kind of costs we're talking about? How big how big a difference that would have made?
So with respect to the P3, the design to deliver a relocation could also be offset by the delivery of a rejuvenated site where it currently is. Now, the magnitude of that was something that was missing from the report, and I do think that that's important information. Now, there could be an offset one way or the other, but that information wasn't provided to decision makers.
With those 4 healthcare audits that you conducted, what to you is the most shocking or surprising finding there?
With respect to that, I'd say the impact on closures and the fact that we have the number of closures to emergency departments. We did note that there were over 200 unplanned closures. However, what we did also note was the ministry program, which is called the Locum program, that was designed to bring physicians traveling from the south to the north to help reduce those closures. And we found that program, we estimated, saved approximately 400 additional closures, which is quite important. But the fact that we have a health human resource problem right now is something that both the Ministry of Long-Term Care and the Ministry of Health need to address as quickly as possible.
I feel like we've heard very little, from the Ministry of Health in terms of the impact of agency nurses on hospitals. Just how significant is it?
Well, what we noticed was the use of agency nurses increased by 25 times in northern hospitals. 25 times. That is, when we looked at the number of hours, there was 15,000 hours of agency nurses used prior to the pandemic, and now we're using 391,000. So you can see that that increase of 25 times is quite significant. And although that is a temporary solution, it comes at a cost, and we think that both ministries need to address that as quickly as possible.
You talked about the need for the government to develop a plan to attract people to the nursing profession. I think the government has told us over and over again that they've done that. What's not working about that plan?
Well, I think they need a strategy. They don't have a strategy at the moment. And I think they need to develop a strategy. When we've conducted our audit, we identified the use of agency nurses is quite significant, especially in the north. And without having a strategy to help address that, I think it's significant. And speaking to northern hospitals, when we compared other provinces have a strategy for northern hospitals. The community in the north is quite different than the community in the south. So without having a dedicated strategy for northern hospitals, I think that's something that the ministry needs to take a look at.
Did the ministry acknowledge that in their response?
Absolutely, and they committed to producing a strategy for northern hospitals.
Auditor, I was hoping we could switch gears a little bit and talk about the aggregate audit. You were documenting lots of issues there with compliance and lack of enforcement, and there was kind of some mention of pollution and risk to communities. I just wanted to drill down on what those risks are. Are we talking about public safety? Are we talking about public health? Like, what's at risk here?
No, so what we noted was the lack of enforcement for aggregates resulted in some companies extracting more than what they were allowed to. So with respect to that, there's limits that they should be doing. And without having proper enforcement for when they complete their aggregate extraction to rehabilitate the land, I think is also key.
Okay, and so does that, like the lack of rehabilitation, can we drill down on like what the consequences there? Like is it environmental? Does it mean that there are going to be impacts to like water supplies? Like why does this matter to the public?
Well, when we looked at it, we've seen a number of companies that were not extracting, and they haven't been extracting for 10, 15, over 20 years even. Now, in their perspective, they may think that they're going to extract at a later time, and therefore they did not rehabilitate. But without having enforcement looking into it and drawing those conclusions, we can't come to our own conclusion to determine whether they should have rehabilitated or not.
Auditor, could you talk a little bit about your findings on the drive testing? I guess generally, how concerned should people be about the quality of drivers on the roads? And if you could sort of point out a few particular highlights, in particular around this trend of city kids going to rural areas to get their to pass their tests, and the adequacy of the testing for seniors.
So we did identify a number of concerns when it came to drive tests. The first and foremost was the reduced requirements post-pandemic. So during the pandemic, there was a large backlog created of people wanting to get their license. And the ministry made a decision to reduce the requirements to obtain your full G. And part of those reductions were, for example, not conducting a three-point turn or not conducting a parallel park. Those requirements were not there when people needed to obtain their full G license. We noted that that backlog was finished by the end of 2022. However, we're still sitting here at the end of 2023 with that reduced requirement still in place. We noted that the ministry tried to obtain some data with regards to the impact of that decision. However, they only did a 6-month review, so we don't think that there's enough evidence and information to justify that reduced driving requirement moving forward. So without having any knowledge and impact, any knowledge about the possible impact to safety with regards to that reduced requirement, we don't know whether they should continue with that or not. That being said, what we also found was individuals who have had their license suspended more than twice had higher fatality rates, 6 times more than those that have not. So people that have had stunt driving or dangerous driving offenses, they never had to be re-examined and retested again. Now, people that are driving under the influence have to do that. So we're suggesting that the ministry have to take a look at this, because fatality rate 6 times higher than the average is something that's alarming.
And the rural, the urban kids going to rural areas for their tests, and the retesting of seniors, I think it's after age 80 they have to.
Yes, so the retesting of seniors, for example, there's no driving test for them. It's a cognitive test. So someone has to go in, basically identify what a clock is, and draw that clock to basically get their driving test or driving license provided. There's no cognitive test to determine whether someone can identify distance and space, something that I think is a key requirement.
Auditor, back to aggregates for a second. You write that there's only 16 inspectors that actually did field inspections in 2022. Do you have any kind of estimate about how many inspectors the ministry would need to appropriately do its oversight?
That was part of our recommendations for that report, for the ministry to assess the number of aggregates, the number of pits and quarries that are currently needing inspection, and therefore determine the resources that they need going forward.
Did you hear anything also about why there's so much turnover in the inspector jobs?
Not with regards to turnover, sorry.
Auditor, can you give us any insight into how the Ontario Police and MZO audits are going, or what timeline they'll be completed by?
We don't speak to audits that are currently underway. I apologize for that, but we can't.
Okay. Do you know when your office will have a full-time AG, and if it'll be yourself?
That's a good question.
The one that you want to know the answer to?
The one that I would love to know the answer to.
Okay. Let us know.
Auditor, on the clock test that you had mentioned for the road test, I mean, I think a lot of people hearing that would say that sounds ludicrous. What was the reason they gave you for why that is an adequate test to judge the cognitive abilities of somebody who's in their 80s?
That was something that they determined a long time ago, and they never revisited it. And we think it's time for them to revisit.
Do you think it's not enough? Is that what you're
That's
getting at?
something that the ministry needs to examine and understand.
Because I know when you take, having had elderly parents, I know when you take them for like a dementia test, that's one of the things that they have to do is draw a certain time on the clock. But there's so many more things on a test like that, so that's why I'm asking if you think there needs to be more than the clock test.
I think that's something that the ministry needs to assess. They need to look at the impact of those over 80 and their driving habits, and the impact on the roads and the safety of the roads.
Don't you think that would overcrowd the system that's already, if there's already a backlog and we're asking more requirements?
No, the backlog was only created during COVID. There is no current backlog at this point.
Can we talk about the Environmental Bill of Rights? This isn't the first time your office has found that there is a lack of consultation when it comes to decisions that will have great environmental impact. I do note that this is the first time you've found that the Ministry of Energy has created an entire plan without consulting. There's a lot of big energy decisions on the horizon. How concerned are you that energy decisions are being made in silos?
Well, we started auditing the Environmental Bill of Rights when we took ownership of that in 2019, and we've seen since then a lack of consultation is something that we've consistently found, and it's pretty much across all the ministries. We've seen some improvement with regards to consultation, but what's probably most alarming is the Ministry of Environment should be championing this and should be educating people on the fact that people should be consulting. And we're finding that they're not doing that. So the lack of consultation is something we've seen time and time again.
But, in every subsequent report, you have, responses from the ministry that commit to upholding the Environmental Bill of Rights and commit to consulting, and yet they don't. I think the language that you use in this time, you use where like they understated the environmental impact of some of the housing policy decisions. You talk about how big energy decisions were made with absolutely no consultation whatsoever. It seems like the ministries aren't following through. And I'm wondering how your office feels about, you highlighting this problem over and over again in very plain and strong language, and there being no change.
Well, part of what we do is identify whether they're compliant with the Environmental Bill of Rights, and we put forward recommendations for them to comply. With respect to the impact of not consulting, we hope that ministries and agencies do consult, because we do think that decision makers should be consulting and getting all the information necessary to make informed decisions.
Auditor, your office made a number of recommendations in the Greenbelt report. Your predecessor made a number of recommendations to the government in the Greenbelt report. Have you been tracking the government's progress on those? Is there any update on how the government has fared when it came to some of the recommendations that you guys have made?
We typically conduct follow-up reports 2 years after we complete our audits. So we'll be doing the follow-up report on that 2 years from now.
Can you give me a sense of what that process looks like? Is it a proactive process where you guys actively investigate what the government is doing, or are you waiting for the government to kind of provide you with an update on where they've been so far in their recommendations?
No, so about a year and a half after we conduct the audit, we approach our auditees and our entities, and this goes for all our audits, not just for the Greenbelt. This goes for all our audits. We approach our entities and we ask them where they stand with regards to the implementation of our recommendations. After we get that, we obtain evidence to determine whether what they've provided to us is fair and accurate, and then we report on those. And we have a chapter in this year's annual report on the follow-ups from 2 years prior.
Why not a year into it?
Sorry?
Why not a year into it? Why 2 years?
We determined 2 years was appropriate time to give enough time to provide them the time and available to provide them enough time to implement the recommendations. Some recommendations do take time. Some are longer. You can't just make a change immediately. So we do continuous follow-ups as well, up to 5 years after our reports. But we start 2 years from now.
And there is a Greenbelt mention in this report. Can you talk about that?
That's with regards to consultation. So that was part of the Environmental Bill of Rights and the lack of consultation. And you've seen the lack of consultation even with the Ontario Science Centre. I mean, the decision to relocate did not have consultation. There's a number of areas where we constantly see lack of consultation.
To be clear, when you say lack of consultation, do you mean with stakeholders, with people who are involved, or as well as the wider public?
Correct. I mean, with regards to the Science Centre, we saw that the landowners weren't even consulted. We identified a number of concerns with regards to consultation. After the decision to relocate the Science Centre, the Ministry of Infrastructure had a town hall where a number of concerns were raised with regards to the relocation. And the ministry identified that the environmental assessment for the redevelopment of Ontario Place will consider and address those concerns. When we reviewed that environmental assessment, we found that they determined that the relocation for the Ontario Science Centre to Ontario Place was outside of the scope.
What does that say to you? They just told you a story and to answer your question while not actually doing what they said they were doing?
Well, we found that they identified that there was a number of concerns in that town hall meeting. They said that they were going to address it through the Environmental Bill of Rights review of Ontario Place. When we examined that report, we found that they excluded that in their assessment.
Do you think the government misled your office?
No, we identified that there was a lack of consultation.
Regarding the Greenbelt follow-up report, I don't know if there was any closure to the situation of the two developers who do not want to cooperate with your office and were using the courts to do that. Can you give us any update on that situation?
I don't have an update on that.
So does your office still want to speak to them, perhaps for that 2-year follow-up?
As I understand, there's a RCMP investigation on the matter, and that's where we're leaving it with.
Will that affect your office's follow-up work?
We don't know at this time.
Auditor, regarding the emergency wait times, can you talk about how big a role the lack of primary care physicians is playing in increasing those wait times?
With regards to the emergency departments, the biggest concerns there with regards to the closures were the nurses. We did find that the locum program helped reduce the number of closures significantly, but the primary cause of emergency closures were the nurses and the shortages of nurses.
So the primary care physicians would not be the bottleneck in this case. Is that what you're saying?
That is correct. It's the nurses in this. There were cases with regards to physicians, but the vast majority were nurses.
But it was the wait times, though. I thought there was an indication in the report that a significant number of people were going to the ERs because they didn't have family doctors.
That is correct. So
commented in the advertising review about one particular ad campaign the government put out touting improvements to the healthcare system, $20 million or so on that. Could you explain what your concerns were about the nature of that ad campaign?
can I get back to you after this media conference on that? I don't know the exact details of that.
Report, it says the Science Centre proposed a 350,000 square foot facility for Ontario Place, but then the government requested something smaller, and then the actual proposal ended up being 110,000 square feet. Why do you have any sense of why the government wanted a smaller facility? Was it cost or just space requirements?
So the idea of relocating the Science Centre isn't something new. It was something that was looked into back in 2016. And at that time, the location itself was examined as being those numbers in the 300 square feet mark. Upon their review, they wanted to assess a smaller size Science Centre, and with that came more efficiencies.
Was efficiencies the reason given?
For more efficiencies, that's correct.
So not cost or space requirements?
Well, efficiencies would result in costs.
Okay. Would it be fair to say that the government's call for a smaller facility has contributed to the lack of some of the other exhibits that are at the current center, like the planetarium and the indoor rainforest, that are no longer going to be part of it?
Yeah, we noted with regards to the exhibits that both the planetarium would not be part of the new exhibit, the new relocated Science Centre, and we identified that as well. That information was also not provided to decision makers when they made the decision.
Did it come out to this reference to the previous government in 2016 considering moving the Science Centre? Did any particular locations come up? Do we know where they were considering moving it to?
They were considering moving it to Ontario Place back in 2016, yes.
Auditor, in regards to the RCMP investigation that you had mentioned, has there been any official communication or contact from the Mounties with your office? Anyone within your office, have they asked for any materials or any evidence that you guys found during your investigation?
So that matter has been referred to the RCMP for an investigation, and I'll let the RCMP do their job.
Right, but has the AG's office been contacted? Anyone in the AG's office been?
It's not appropriate for me to speak to anything with regards to an RCMP investigation.
Is it your understanding that all of the material that the AG's office was able to procure during your investigation, does that stay with your office, or if the RCMP asks for that, or any policing agency asks for that, are you able to hand over those materials?
Unfortunately, it's inappropriate for me to speak to an ongoing investigation of the RCMP.
But he's just talking in general, though.
What is the policy?
And
what is your office's policy regarding turning materials over to the police? Do you
Does
require
legislation
warrants?
comply or compel you to comply with an investigation?
Right now, there's a current investigation undergoing with the RCMP, and it's not appropriate for me to respond to anything.
Like you can respond to the legislation. The legislation actually prescribes certain actions for your office when a criminal investigation has started, doesn't it?
It's inappropriate for me to speak to an RCMP investigation that's currently underway.
So what about those in the past, like when it was the Liberal government that was under investigation? Did the Auditor General, was the Auditor General required to hand over documents?
I don't recall an RCMP investigation under that
There was
term.
the OPP investigation
Yeah.
into the gas plant scandal, so do you know if, I don't know if you were with the auditor then, but do you know if anything was handed over to the OPP during that time?
I'm unaware of that.
You can't tell us what the policy of your own office is.
Yeah,
We don't understand, we're not asking, we accept that you can't tell us anything about the RCMP investigation or whether you gave them documents or not, but what is the policy of the AG's office? On paper, if you went and got us a rule book of what your staff are required to do when the police call, what does that book say?
So given the fact that an RCMP investigation is underway, it's inappropriate for me to comment on anything.
Is it because you're unclear?
You just do not know?
No,
Okay.
it's not that.
You do know.
Because there's an RCMP investigation currently underway, it would be inappropriate for me to comment.
But if I'm sorry to be pedantic about this, but if a member of the public came to the AG's office and said, hey, you know what, I want to review all the emails that you guys got from the government, would you be able to share that with a member of the public?
No, we don't share that with a member of the public.
If a
Our
journalist,
working papers are secured.
okay, if a journalist were to file a Freedom of Information Act request for that information, would you be able to share it with them?
We don't share that with any FOI requests. Our working papers are secured.
And if the police came to ask for any of that material, would you be able to share it with them?
As there's an investigation currently underway with the RCMP, it would be unfair for me to comment. Thank you, guys.
Auditor General, I'd like to talk for a second about the Ontario Tourism Recovery Program. Your report notes that there were 570 total recipients, but you tested only 90 applications.
Yes.
Why that decision?
We always test a sample. We don't do a fulsome 100% sample. We did find that 6 applicants out of the 90 applicants we reviewed received a total of $1.1 million despite being ineligible.
It's reasonable to conclude from the sample that there are possibly in that pool of 570 more people who were ineligible but received, or more applicants who were ineligible but received funds.
Given that we found a sample of 6 in a sample of 90, if you extrapolate, there's a chance that there will be more.
So potentially, could the cost to the Ontario taxpayer have been well above the $1.1 million that you identified?
There's the potential to be higher than the 1.1 million, yes.
Thank you so much.
With the emergency departments, the Northern Healthcare, the Public Health Ontario chapter, you identify a number of cases where either the government has out-of-date compensation for things like mileage, or there were plans that were made to consolidate labs for Public Health Ontario that never went forward, but the funding was reduced anyway. I mean, would it be fair to say that the government is underspending on healthcare, despite the fact that it is the largest expense in the budget?
I think there's a number of areas that the Ministry of Long-Term Care and the Ministry of Health need to take a look at. With respect to Public Health Ontario and the labs, we noted that 3 of the labs were barely used, and a lot of the testing had to be shipped somewhere else. So there's a lot of efficiencies that need to be looked at and addressed, yes.
But I mean, efficiencies is one thing. Your office frequently finds waste and inefficiency, but there also seems to be a theme in the healthcare chapters that some things the government just needs to spend money on. For example, retaining and recruiting nurses. It's not just a matter of finding economies.
Yeah, as part of the strategy, especially for nurses, they have to understand they're spending a lot when it comes to hiring temporary nurses through these agencies. 2-3 times more sometimes than they would be paying a regular nurse. So they need to kind of take a look at whether they should be reallocating some of that money instead of going to agency nurses to nurses themselves. It's part of the strategy that we're recommending that they take a look at.
I just want to follow up on a question from earlier about what you were talking about aggregate companies not extracting for many years. Why does that matter? What's the risk there?
The rehabilitation of that land, that's the biggest concern. So once when those companies are finished with those aggregate pits, they should be rehabilitating them back to their normal state. So we understand that, yes, there may be use for them going forward, but when we see that some of these areas haven't been touched for over 20 years, we question whether the validity of them being used again is there and whether they should be rehabilitated.
And if they're not rehabilitated and it's just a sitting pit of gravel, what are the effects on the surrounding area?
Well, that's part of the environmental assessment there. So there's environmental concerns if they don't rehabilitate.
When reviewing agency nurses, which you did in several parts of this report, was there any reason, did you find any reason to conclude that the government's use of agency nurses and continued use was more of a feature than a bug? In other words, was this, was this either deliberate or was this done through inaction? Is this privatization through another means?
No, we didn't come across anything like that. What we did come across is that that's a solution that they're trying to use right now. There was a huge shift of nurses post-COVID pandemic, and right now that's their solution, and we don't think that that's a long-term solution. It's a temporary solution to get them through things right now, but we don't think that that's a permanent solution, and that's why we recommended that the Ministry of Long-Term Care and the Ministry of Health work together in figuring out a strategy moving forward.
You've mentioned a sort of pattern that's emerged of a lack of consultation on the Science Center.
Not just the Science Center. In general.
What do you think? Has the government ever given you like an explanation of why they're so they put such a low priority on this? Like, is there a justification that you've come across that explains why they pay lip service to consultation and then ignore what they receive?
I can't speak to the intent of the government. What we can speak to is the fact that we think consultation should be there. The fact that some major stakeholders were not consulted is concerning to us, and that's what we're bringing forward here. The fact that school boards, who account for 25% of attendance at science centers, weren't accounted for and consulted was concerning. The fact that the Toronto Regional Conservation Authority, who owns the majority of the land of Science Centre, was not consulted, once again, is concerning.
Why is it concerning? What do you fear will be the consequence if this kind of pattern continues?
We think that consultation is a key component in decision making, and without consultation, those that are making decisions are not having all the information necessary to make the correct decision.
Do you have a sense on who the government is consulting, if any?
No. We know that there has been discussions subsequent to the finalization of this report with the City of Toronto. I think that there's been some news about that in the last week.
Say, you cite energy decisions, for example. Who has the government consulted? If not the major stakeholders or cities, have they talked to?
There's nothing that we've come across there.
There's no pattern about like who the province seems to take more seriously in consultations than others.
There's a pattern of not consulting.
I think we've already got
no further questions.
I appreciate everyone's time. Thank you so much.
Thank you.